Hello everyone. In today's video, we would be discussing about the anatomy of brachial artery and its clinical significance. Brachial artery, it is the continuation of the axillary artery. So this is subclavian artery. It comes down into the axilla, becomes the axillary artery, and the axillary artery, as it comes at the lower border of the teres major muscle, it becomes brachial artery. So teres major is basically a muscle which is coming from the dorsal aspect of scapula to the humerus, and it is in such a manner that it becomes related with the brachial artery. So brachial artery basically begins at the lower border of this teres major muscle. It runs downwards in front of the arm, and after crossing the elbow joint, it terminates into two branches, and it is superficial throughout its extent. So at the level of neck of radius, that is, this is the radius bone and this is the neck of the radius, and at this location in the cubital fossa, this region is the cubital fossa. In this cubital fossa, the brachial artery terminates into radial and ulnar arteries, and this artery, brachial artery, you can see here there is a muscle parallel to this brachial artery. This is the biceps brachii muscle, and this is the tendon of the biceps brachii muscle. So brachial artery is located medial to the tendon of biceps brachii muscle. If we talk about the relations of the brachial artery, throughout the artery in the arm, it is accompanied by two venae comitants. Two veins accompany the brachial artery, especially in the arm region. Further, if we talk about the relations, the anterior and posterior relations of the brachial artery. So anteriorly, if you see here, this is the median nerve which is formed by the lateral and medial cords of the brachial plexus. It is the anterior relation of the brachial artery, especially in the middle of the arm. It crosses the brachial artery, and in front of the elbow, in the elbow, you can see that the brachial artery is covered by the bicipital aponeurosis, which is an extension of tendon of biceps muscle. So at the level of elbow, anteriorly, the brachial artery is covered by the bicipital aponeurosis and also by the median cubital vein. So these are the anterior relations, that is median nerve in the middle of arm and bicipital aponeurosis and median cubital vein in the front of elbow. The posterior relations of this artery are the posterior compartment muscle of the arm, that is triceps brachii. So you can see the heads of the triceps brachii. They are related posteriorly to the artery. And also the brachial artery, as soon as it begins at the lower border of teres major, it gives a branch which is known as profunda brachii artery, and this branch goes to the back side of the arm in the posterior compartment, and it runs in close relation with the radial nerve, which is also present in the posterior compartment of the arm. So these are the posterior relations of the brachial artery, that is the triceps muscle, the radial nerve, and the profunda brachii artery. Now the medial and the lateral relations of the brachial artery. So if we have a look at this figure, the medial relations in the upper part, the medial relation of the brachial artery is the ulnar nerve. You can see that this artery is in the center, and there are two nerves on each side. So the nerve on the medial side, because medial side of the upper limb is the ulnar side. So you, on the medial side, you have the ulnar nerve. And in the previous figure, on the medial side, there is the basalic vein, which is also related with the brachial artery medially. Now, in the lower part, you can see here, in the lower part, medially, there is the median nerve. So, median nerve is also the anterior and lateral relation of brachial artery, and in the lower part, it is the medial relation of the brachial artery. So, these are the medial relations. The lateral relations you can see here that the brachial artery is related with median nerve in the upper part. It is related with this muscle which is the coracobrachialis muscle of the front of arm. These two bellies are of the biceps brachii muscle. So it is related to median nerve, coracobrachialis and biceps in the upper part. And in the lower part, laterally, there is the tendon of the biceps muscle. So these are the lateral relations of the brachial artery. Now the branches. So as soon as the artery begins at the lower border of teres major, it gives a profunda brachii artery which runs in the radial groove in the posterior compartment of the arm. It accompanies the radial nerve. Then in front of arm, in the upper part, the brachial artery gives two collateral branches because these branches are running parallel to the main artery. So they are running on the ulnar side, on the medial epicondyle side. So these are known as ulnar collateral arteries. There is a superior ulnar collateral artery and there is an inferior ulnar collateral artery arising from the brachial artery. And these two arteries, they also participate in the anastomosis around the elbow joint. What you see here at the elbow joint, the arteries, that is the branches of the brachial artery and the branches of the upper part of radial and ulnar arteries, they form a communication, they form an anastomosis around the elbow joint. Finally, the terminal branches of the brachial artery in the cubital fossa are the radial and ulnar arteries. Apart from these branches, the brachial artery gives a nutrient artery to the humerus and it also gives multiple muscular branches to supply the various muscles of the upper limb. Now finally, as we had discussed, there is an anastomosis or communication between branches of the brachial artery and upper end of the radial and ulnar arteries. So there is an anastomosis on the lateral epicondyle side, that is front and behind the lateral epicondyle, and there is an anastomosis also on the medial epicondyle side, that is front and behind the medial epicondyle. So if we have a look at this figure here, this is the lateral epicondyle side and the brachial artery, as soon as it begins, it gives the profunda brachii artery. This artery goes behind and it gives two descending branches. These branches are coming down, they are descending. So there is an anterior descending branch and there is a posterior descending branch. The anterior descending branch of profunda brachii artery anastomoses with the radial recurrent branch of the radial artery. This artery is going up, so it is the recurrent artery. So this is the anastomosis in front of the lateral epicondyle. Now behind the lateral epicondyle, there is anastomosis between the posterior descending branch because it is behind. So there is posterior descending branch of the profunda brachii and another branch is coming from the upper part of the ulnar artery. That is the ulnar artery gives a branch which is known as common introitious artery, which divides into anterior introitious and posterior introitious, and posterior introitious finally gives a introitious recurrent. So you can see here that there is a branch going upwards. This is the, and also on the back side, this is the introitious recurrent and it is anastomosing with the posterior descending branch of the profunda brachii behind the lateral epicondyle. So this is the anastomosis in front and behind the lateral epicondyle. Now we come on the medial epicondyle side. So in front you can see that the inferior collateral branch of the brachial artery is forming anastomosis with the anterior ulnar recurrent and the superior ulnar collateral is forming communication with the posterior ulnar recurrent artery. So this is the front and behind communication on the medial epicondyle side. Now finally, the clinical significance. Brachial pulsations, brachial artery is auscultated medial to the tendon. This is the tendon of biceps, this is the medial epicondyle. So medial to the tendon of biceps, there is brachial artery. and brachial artery is the significant artery for recording blood pressure. Brachial artery, as I had already said, that it is superficial throughout, so it can be compressed anywhere, but its most favorable location is the middle of arm because it lies on the tendon of coracobrachialis. That's all for today. Thank you so much for watching the video. Please do like, share, comment, and subscribe to the channel. Press the bell icon for more videos filled with medical knowledge.